Welcome to Empowering Plans, a show dedicated to identifying waste and undue expense in the health benefits industry, discovering ways to maximize benefits while minimizing costs, and empowering employers, administrators, and consultants to emphasize, once again, the benefit in benefit plan. Today's episode is brought to you by the Phia Group, empowering plans since 1999. Now here are your hosts, the Phia Group's own CEO, Adam Russo, and Senior Vice President and General Counsel, Ron Peck.
Hello, everybody, and welcome to another episode of Empowering Plans. My name is Adam Russo. Here with me today is my co-host, Ron Peck. Say hello, Ron.
Hello, Ron.
And we're going to do something different today. We're not going to talk about something that might be on the tip of everyone's tongue. We're not going to talk about the new healthcare plan, Trump Care. We're not going to talk about the ACA, Obamacare. We're going to assume that all that stuff's not going to work. What do you think, Ron? We're just going to make that assumption.
I think that's a good odd.
What we want to focus on is really talking about different ways to pay for healthcare. And I know that sounds crazy, but imagine the idea that when you walk into a hotel, the first thing that happens when you check in is they always give you a little card. And on that card, it tells you your room number and it tells you the rate for the room. Imagine if you went to a hospital or a doctor's office and you actually knew what the rate was before you check in.
Stop it.
I'm being crazy, Ron. I know that. But what do you think of that, Ron?
I think that once upon a time, that kind of idea, that idea of transparency, of more commercialism, consumerism in healthcare was a pipe dream. But believe it or not, I think we're starting to see some movement at every level, facilities, physicians, elsewhere. And I believe, or at least I hope, that some of those innovative ideas are going to find their way into the mass market.
The funny thing is, in the hotel example I gave you, no one would ever consider knowing the price of the hotel room to be called a quote-unquote alternative arrangement. That would be the typical way you pay.
Status quo.
You walk in, you know what the fee is, you pay the fee, and you're seen. In our world, in the crazy world of health insurance and healthcare, the stuff we're going to talk about today is the alternative. So just for a little plug, on Thursday, June 22nd, we're going to really get into this with an hour-long webinar where we're going to call it A Network by Any Other Name, where we're basically going to talk about all the different options out there where if you're not happy with the status quo, if you don't believe the ACA is the way to go, if you're not happy with your HMO, if you're not happy with your fully insured plan, if you're not happy with the way your self-funded plan is going, we're going to talk about alternatives on our June 22nd webinar to things that you can do to really lower the cost of care and empower your plan. The first thing I want to bring up, and it's something that Ron and I are both very excited about, is the Free Market Medical Association, the FMMA. It's pretty hard to say over and over again, but FMMA. We recently started the Massachusetts chapter of the FMMA, and we are amazed and excited about the feedback that we received in a short week related to our involvement, our opening this opportunity to many providers, administrators, employers, brokers, advisors, etc., in the state of Massachusetts. And what is FMMA? It's the free market. It's where all the entities in our industry, doctors, facilities, clinics, go and we share. We actually talk about, here's the pricing, these are the bundles, these are the things that we can do to lower the overall cost of care. And everyone in our industry benefits because we're taking away much of the bureaucracy, much of the middlemen, much of those pieces, the mysterious pieces of our healthcare industry that really nobody understands and that we need to get rid of in the first place. So that is something that I have experienced over the past few years, and the growth that we have seen in the FMMA has been tremendous. My good friends, Dr. Keith Smith and also Jay Kempton from Kempton Administrators over in Oklahoma City, Oklahoma, started the FMMA a few years back. And every year we have gone, every year we have sponsored, every year the Phia Group has been really involved with this organization. And we have seen it blossom. We're talking about from a beginning of 20, 30 people to now there are hundreds, if not thousands of people that are involved, that go to the national conferences and looking at this alternative arrangement where providers are paid directly. Ron?
You know, it's funny, Adam. The FMMA and now locally the FMMA-MA, I'm really excited about it just like you because of that idea of free market transparency. People throw that word transparency around like they used to throw around the term boots on the ground, right? It's everybody says it, but no one really understands what they're saying. But at the same time, I think the timing for it is really ripe because I can tell you one example of a type of provider that we would routinely promote both industry-wide and within our own plan are the urgent care facilities. We would tell our employees, hey, look, before you head off to the ER, right, question it, ask, should I be going instead to one of these urgent care facilities? And we did incentivize employees. We did eliminate copays for the visit to the urgent care instead of the ER. And I will tell you that at our own plan, the usage of these urgent cares instead of the ER, it was pretty substantial. It certainly moved the needle. The problem is now you're starting to hear, and Adam, I think you've brought this up in past podcasts and webinars, you're starting to hear now about hospital systems purchasing up these urgent cares and opening up their own urgent cares. So even though it's a self-standing office, you walk in there, next thing you know, your bill and your EOB indicate that you visited the ER and you're being charged hospital rates.
If anyone else did that, they go to jail.
Absolutely.
But it goes on in our industry now, and no one cares about it. No one talks about it. Here's the thing. These urgent care clinics, why did they pop up in the first place? Because there were consumers that were ready for it. People didn't want to wait in the emergency room for a sprain. They did not want to have to create an appointment with their doctor because they have poison ivy 3 weeks from now. They need an appointment today. And they don't want to go to the emergency room where there's people with gunshot wounds that probably will get seen first before your rash. The point is, these have blossomed. They have popped up everywhere. And we have taken advantage of it. And what we have seen is that the hospitals and many other facilities all across the country, they see it too. And what do they say? We need to have one of those. We need to make one of these places look like a freestanding clinic, but still be able to get our revenue stream from them. To change course a little bit, I had a call this morning with a pretty prestigious broker here in Massachusetts, and they've been listening to our podcast. They go on our website, they read all of our stuff. And the first thing he says to me is, Adam, I have a group. I have an employer group. They've been self-funded for 5 years. They're ready to do all these things. They want to incentivize their members. They want to promote it. They want education. They want the HR department to empower every employee to do all these things to save the plan money. And I go, great. And they go, what do you need from me? I'm like, who's administering the plan? And when they told me who was administering the plan, the first thing I said is, forget everything I've been saying over the past few months. You can't do any of it because that particular administrator won't allow you to be empowered. They won't allow you to do these alternative provider arrangements. Next thing I said is, what is the pain point? What are you spending on claims? And they go, we don't know. I said, what do you mean you don't know? We just know what the premium is. We just know what every month we have a total that was due that we have to pay by check. You don't get a data dump of all the claims paid so you can actually see where your risks are? No, we don't. And I said, sir, until you can actually share with us the data that's going to tell us these are your pain points. You're spending money on emergency rooms that could be diverted to urgent care. You're spending money on MRIs within a hospital system that could be going to a freestanding clinic. 18% of your money is being spent on pharmacy claims. There are alternatives to these pharmacy claims here domestically and abroad. Until you know what your current situation is, it's really hard to come up with an alternative that will meet your specific needs until you actually know where your pain points are.
You know, it's funny, Adam, because when we talk about things like transparency and the Free Market Medical Association, we're looking at things like positives. What am I going to spend? What are the prices? So that I can make positive, proactive decisions. But I think when you talk about transparency and a free market, things like data and being able to adjust based on your past history, being able to customize your plan, this information that's not being withheld by a hospital, not being withheld by the provider, which is where we normally point the finger, but also being withheld by people within our own industry, the health benefits industry, the health insurance industry, the network industry. That's a lack of transparency just as bad as any hospital that doesn't reveal its charges.
Right, and I can tell you another thing. Yesterday, I had a call with another advisor. Do you notice these? It's always a trend. It's these daily calls. And that gentleman said, hey, I have an employer here in Texas who wants to do a direct contract with their local hospital. Again, an alternative provider arrangement. Actually going direct to that facility and making a deal. I go, great. I'm like, so what's the current scenario? Well, currently, that employer accesses a network, and that network has that hospital in it. But we want to keep that network. I'm like, wait a second. So you want a direct contract with the hospital that is already part of that network? He's like, yes. Why would the network agree to that? The network is the middleman. They have made a deal to get a discount from that hospital for your employees to be able to go to that facility. You think they're just going to allow you to keep the network for all other claims, but to breach it for just that one hospital that you decided to make a direct contract with? That is the problem. In our industry, we all want to have the cake and eat it. You have to realize that sometimes if you want to have a direct contract, you might need a narrow network. If you have every single person in your network, then who are you directly contracting with? These are the things that people need to think it through. So when you have a situation where you have multiple direct contracts, you also need to be aware of the fact that potentially you could be creating a brand new network, that now you are the quote-unquote enemy, the monster that you don't want to become. You're becoming it right then and there.
That's pretty dramatic, Adam. I feel like we're starting to pitch a movie theme. When we talk about relationships with the providers and this idea of direct contracts and narrow networks, obviously we're looking at it from the perspective of the provider as much as the payer. We're saying, hey, what do they value? Things like steerage, prompt payment. What can we give them in exchange for a better deal? And I like that attitude. I like that commercialism. I like the fact that we're communicating. At the same time, you really heard a few years ago about the idea of these ACOs, right, where the healthcare provider, the payer, the plan, the patient, they're all part of sort of one arranged community, and everything's worked out ahead of time, and you're being paid for performance instead of for the service. And I remember that this was the hot topic that everybody was talking about, and while it certainly hasn't gone away, I don't think it's really blown up the way that people thought it was going to.
Ron, you and I could be talking about this for hours. Here's the reality, folks. Today, what's going on in the industry? What are the alternatives? You have direct primary care. You have on-site clinics. Our good friend Ernie Clevenger and his Care Here organization, which has done wonders with on-site clinic from wellness to primary care to preventive care all across the country. You have things such as dialysis, air ambulance, specialty drugs, looking at out-of-network options. All these things are available. They're all alternatives. But you have to be willing to change. If you think you could just keep on doing what you're doing and then throw these things as frosting on top of that cake, that's where you're wrong. We can help. We here at the Phia Group are available to help all of our clients, but you also have to have the ability and need to help yourselves. On behalf of Ron Peck and myself, Adam Russo, thank you so much for joining us here on Empowering Plans. We'll see you next time with our next podcast. Have a great week.
Thank you.